Rhinoplasty or nose job post-operative care. It's very important to take care of your nose after surgery. Half the battle is surgery, the other half is taking care of it afterwards to make sure it heals well. Typically after rhinoplasty you will have a splint on the top, and you might have some packing in the nose or you might not, and you might have stitches underneath right here in case of an open approach, and you might have stitches along the side here in case of alarplasty or nostril reduction. The first thing is to keep yourself comfortable. So after surgery, do lots of icing, which helps with the pain. Take the pain medication given to you by the doctor and other supplies that have been given to you as well. Typically you will have to make sure that you clean your nose at least 3 times a day. You will need hydrogen peroxide, regular hydrogen peroxide over the counter, and Q-tips. And what you do is you take a lot of Q-tips, you dip them in there, looking in the mirror, you clean around the sides. Remember, the splint is going to be in the way, so you don't have to go underneath the splint too much and lift it, but wherever you can get underneath, clean, clean. If the stitches here, keep cleaning them till you know that you've taken off all the dry blood, and use a mirror, preferably a magnifying mirror. Then you can get a fresh one and clean with hydrogen peroxide inside the nostrils, unless you have a packing that does not allow you to go in. And when you clean, you can be gentle and go in there, but don't pull on anything because there are absorbable stitches on the inside. There are blood clots as well, so gently keep working on them, get more Q-tips, keep working. In the first 2 days, it might take you a lot of time to just keep slowly working and opening and getting all that junk out. After you clean it, and you feel like, well, I've cleaned it all, then spray the nose with saline spray. That'll clean it further. Dry it a little bit, and then apply antibiotic ointment if it has been given to you by the surgeon. In my practice, we use mupirocin or Bactroban ointment. So you take a fresh Q-tip, and remember, cleanliness is very important. Wash your hands before each cleaning, please. Sometimes we even have patients use Hibiclin's hand wash to make sure that you do not touch your nose. That is a complete no-no. You cannot, not even this, absolutely not. Only Q-tips, or use a gauze to clean if you have to. So then you apply the ointment all around. So you don't have to go high up, just barely inside, apply it in there, and you're done. You have to do that at least 3 times a day. If you do more often, that's fine. Try not to blow your nose. If you have to, spray a lot of saline and very gently. If you have to sneeze, no problem, sneeze. But open your mouth and let the air and the pressure out through your mouth, where you go like, Hach! So the pressure is going out through your mouth. And no blowing hard like, please do not do that. Avoid bending over. That increases the pressure in the nose and you can bleed. Avoid any lifting, any pushing. Avoid even straining on the bathroom like, if you're constipated, please. That can lead to a nosebleed as well. Sometimes you will notice when you leave the surgery center or the office, you will have a gauze under the nose with some tape on it. That is just to catch the blood, because typically we do not pack the nose. So for the first 2 days you do get some dripping of blood, and that's okay. When it gets red, you change it to a new gauze. That's all you have to do. For the first 2 days especially, lots of icing. Use ice all over the face right there. Make sure it's not hard ice and it's not in direct contact with the skin, because you can get skin burns. One way to make sure of that is to get the commercial soft ice packs, or mix water with a little bit of alcohol, just rubbing alcohol in a Ziploc bag, and that'll keep it like a soft gel. And throw a washcloth over so that you're not putting it directly on the skin. And with ice, keep it on for 2-3 minutes, break for 5 minutes. 2-3 minutes, break for 5 minutes. This way you will not burn your skin. And when you're trying to eat something, please be careful that you don't bump your nose, like trying to eat in a big apple or a burger. Cut things and then put them in the mouth to eat, but there's no limitation on eating or drinking whatever you want. And pain medication should be used to reduce the pain, because if the pain is high, that can increase the blood pressure and that can lead to a nosebleed as well. And if you have been given any antibiotic, make sure you take it. Typically we don't give any antibiotics, just the antibiotic cream to apply in there. If you follow those instructions, I think you'll do very well. And make sure you keep this area dry, meaning no shower, only a bath, because if the splint gets wet, it will come off, and we want to leave it on for anywhere from 3 to 6 days, and you don't want to take it off prematurely. Those are the main things you need to know. Again, very simply, hand washing, regular cleaning, rest, and enjoy the results. And if you have any questions, give us a call. Thank you.